For thousands of years, humanity has shared the earth with animals in a relationship built on survival, loyalty, labor, companionship, and trust. Long before modern cities existed, before hospitals, before laboratories, before written language itself, humans depended on animals for food, transportation, protection, and farming. But in those early days, disease spread without explanation. Entire herds could disappear within weeks. Horses collapsed in battlefields. Dogs that guarded villages became weak and aggressive. Livestock died during harsh winters, leaving families starving with no understanding of why it happened. And in the middle of all this uncertainty, the foundations of veterinary medicine quietly began to emerge. The story of veterinary medicine is not simply about treating animals. It is the story of civilization, learning that the health of animals and the health of humans are deeply connected. Ancient societies quickly realized that, when animals became sick, people suffered too. Crops failed without oxen to plow the land. Armies weakened without horses. Communities starved without healthy livestock. Across Mesopotamia, Egypt, India, China, and Greece, early healers started documenting diseases in cattle, horses, and sheep. Primitive treatments were created using herbs, wools, minerals, and rituals that mixed observation with spiritual belief. Some methods worked surprisingly well. Others were dangerous guesses born from desperation. But in ancient Egypt, animals held sacred significance, and physicians often specialized in treating specific species. Archaeological records suggest that Egyptian healers treated cats, birds, cattle, and dogs with remarkable attention. In India, some of the earliest written veterinary texts appeared over 2,000 years ago, describing surgical procedures, anatomy, nutrition, and disease management for elephants and horses. These animals were not only valuable assets, they were symbols of power, warfare, and economic stability. Meanwhile, in ancient Greece, philosophers began studying anatomy and biology with greater curiosity. Observations about disease transmission slowly evolved from superstition into structured medical thinking. But for centuries, veterinary medicine remained limited by one major obstacle. Humans did not truly understand disease. There were no microscopes, no bacteria theory, no vaccines, no antibiotics, and no knowledge of viruses. Treatments relied heavily on visible symptoms alone. If a horse stopped eating, healers tried changing its feed. If cattle developed infections, they applied herbal mixtures or primitive surgeries. Success depended largely on experience, instinct, and luck. Even so, veterinary care became increasingly important as civilizations expanded. The larger human societies became, the more dependent they were on healthy animal populations. During the Middle Ages, veterinary practices across Europe stagnated under widespread disease outbreaks, war, and limited scientific progress. Yet animals remained central to daily life. Horses powered transportation and military campaigns. Oxen worked fields from sunrise to sunset. Sheep supplied wool for entire economies. Dogs protected property and assisted hunters. Without functioning animals, medieval society could not survive. Blacksmiths often doubled as horse healers. Farmers passed down animal remedies through generations. Knowledge spread slowly, usually through oral tradition rather than formal education. Then something changed in the 18th century that would transform veterinary medicine forever. Europe was being devastated by catastrophic livestock epidemics. One disease in particular, known as rinderpest, wiped out millions of cattle across the continent. Entire agricultural systems collapsed. Food shortages spread rapidly. Economies suffered enormous damage. Governments finally realized that animal health was not a small rural issue. It was a national crisis. In response, the world's first veterinary school was established in France in 1761 by Claude Bergelet, a man who believed animal medicine deserved the same scientific seriousness as human medicine. That moment marked the birth of modern veterinary science. For the first time in history, veterinary medicine became an organized academic profession. Students studied anatomy, pathology, physiology, and surgery in a structured environment. Scientific observation replaced superstition. Veterinary education soon spread across Europe and eventually the rest of the world. As industrialization accelerated in the 19th century, urban populations exploded, increasing demand for meat, milk, transportation, and farming efficiency. Animals became even more economically important, and veterinarians became essential protectors of public stability. But veterinary medicine was evolving into something far bigger than livestock care alone. Scientists slowly began uncovering a terrifying truth. Many diseases affecting animals could also infect humans. Rabies, tuberculosis, anthrax, plague, and countless other illnesses crossed between species. This discovery fundamentally changed how societies viewed veterinarians. They were no longer simply animal doctors. They became guardians of public health itself. The development of germ theory revolutionized everything. Once scientists like Louis Pasteur demonstrated that microorganisms cause disease, veterinary medicine entered a new era of precision and prevention. Vaccines began saving both animal and human lives. Pasteur's rabies vaccine became one of the most groundbreaking medical achievements in history. Suddenly, diseases that once guaranteed death could be controlled. Veterinary laboratories expanded rapidly. Research intensified. Governments introduced animal inspection systems to protect food supplies. Meat and dairy safety became scientific priorities instead of assumptions. By the 20th century, veterinary medicine had transformed into one of the most complex and diverse medical professions in existence. Veterinarians worked not only on farms, but also in cities, research facilities, wildlife reserves, military operations, zoos, and public health agencies. Their responsibilities expanded far beyond treating injuries or illness. They monitored disease outbreaks, protected ecosystems, developed vaccines, conducted surgeries, improved food safety, and studied animal behavior. At the same time, society's emotional relationship with animals was changing dramatically. Dogs and cats were increasingly viewed not just as working animals, but as family members. Companion animal medicine exploded in popularity. Veterinary clinics began appearing in urban neighborhoods around the world. Pet owners demanded higher levels of care, leading to advances once thought possible only in human hospitals. Modern veterinary medicine now includes MRI imaging, chemotherapy, organ surgery, physical rehabilitation, dental procedures, cardiology, neurology, and even mental health treatment for animals. A veterinarian today may perform a life-saving surgery on a dog in the morning, investigate a disease outbreak in cattle during the afternoon, and advise wildlife conservation teams by evening. Few professions demand such an enormous range of knowledge. Veterinarians must understand anatomy across multiple species, each with unique biological systems. A symptom that signals danger in one species may be completely harmless in another. Even something as simple as medication dosage becomes incredibly complex when patients range from tiny birds to massive horses. And unlike human patients, animals cannot describe their pain. They cannot explain where it hurts or how long symptoms have lasted. Veterinarians must become investigators, relying on behavior, movement, physical examination, and subtle clues that many people would never notice. A slight change in posture, a different breathing pattern, a loss of appetite, a shift in eye movement. Tiny details can mean the difference between life and death. Despite this, millions of veterinarians continue dedicating their lives to animal care because the work reaches beyond medicine itself. Veterinary science sits at the intersection of biology, agriculture, ecology, public health, and human emotion. It protects food systems. It strengthens economies. It safeguards ecosystems. And perhaps most importantly, it preserves one of humanity's oldest relationships, the bond between humans and animals. The concept known as One Health emerged from this understanding, the idea that human health, animal health, and environmental health are inseparable. A disease affecting wildlife can threaten livestock. A livestock outbreak can affect food supplies. Environmental destruction can push viruses closer to human populations. Everything is connected in ways previous generations never fully understood. And standing in the middle of that connection are veterinarians, working quietly behind the scenes to prevent crises most people never even see coming.